This is the real deal, the real 5-star hospital, the 2-year story of Benin medical care. From the moment you come in through the doors to when you leave, you go with a unique experience. Everything is focused on the well-being of the patient, or guests as they call them, and hence the BMC is patient-centric. From the smiling and warm welcome to the consulting rooms where your vital signs are taken, the smooth stairways, the easy mobility through the lift, the automated and computerized processes, the bank of sophisticated and the latest medical equipment for diagnosis, the pharmacy and its counseling service for the patients, the numerous directional signs everywhere, the spacious, neat and well-lit interior, to a deep sensitivity of patients and hospital, that a bill of rights of patients is on display as well as patients' obligations, to the sheer aesthetics of the ambience of the hospital, beautiful outside and peaceful inside. 24/7 power source and safety consciousness. The bold and clear vision and mission statement to be the first choice of excellent services, to be committed to address health challenges of Nigerians through cutting-edge technology. Benin Medical Care is a must-come-to center. The emergency alert bell rings, and that sets up a flurry of activities in the accident and emergency department, bringing in doctors, nurses, assistant nurses, and porters.
This is the emergency room of Benin Medical Care. We assess the patient outside and bring the patient in to the emergency room. We have a couple of beds here, so we place the patient in one of the beds. If we check the SpO2 and the SpO2 is low, we have to put the patient on oxygen. We have the points for oxygen here. So we also cannulate the patient. We put up a line for the patient. While putting up a line for the patient, we have the sample bottles here. We collect samples. While the lab scientist is standing close by, we give the samples to the lab scientist who takes the samples to the lab to carry out the test. And then, depending on what the patient presents with, we try as much as possible to resuscitate the patient, give the patient fluids while we wait for the lab results to come out so that we know our final treatment. Then also we have our system, the computer, where we enter the patient's details. As the patient comes in, the person in the front desk takes the patient's details and goes to her station to upload the details. So we use our system to fill in the history of the patients and put in everything and wait for the test results. As soon as the test result comes out, the result is being sent to us from the lab. We check the result in our system, and then that would guide us in further treatment for the patient. Normally, a patient is being observed here for about 4 hours. After 4 hours, we have to make a decision whether the patient is going home or whether we are transferring the patient to the ward.
In case there is a great need, there is an emergency theater nearby.
This is the emergency theater room. It is one out of the 5 theaters that we have in Benin Medical Care. Here we do circumcision for male children. We carry out excision biopsy. We carry out suturing of trauma cases, of lacerations and all that are being rushed to the emergency. We suture them here. If at any point in time we discover that the patient is desaturating and needs oxygen, we have to connect the nasal prong to this point and connect it to the patient, and then we put on the oxygen.
What are the many services the Benin Medical Care offers? Dr. Raphael Odia is the head of clinical services.
It's the hospital and the diagnostic center, and the key thing we do here is to render clinical services to patients, which we call guests in Benin Medical Care. It covers both the doctors, the nurses, the pharmacists, the laboratory scientists. There are different cadres of all of these professionals that I've mentioned. So we have junior doctors, we have senior doctors, we have consultants amongst them, we have a pediatrician, gynecologists, family physicians, and amongst other specialties that we have. Then we have different cadres too for the nurses, including those that specialized in various subspecialties like pediatrics, accident and emergency, and peri-op nursing. Over time, we have increased in the number of our services from just outpatient initially to having to admit several patients. We've seen over 30,000 patients in this hospital since inception on the 1st of November 2019. We have also had 273 deliveries, which is huge, both normal deliveries and cesarean sections. We have had to do some complicated surgeries. We've had to excise some lesions or some tumors from brains in this hospital. We have an ICU that has also catered for some patients that are critically ill, either that came from some theater or that came as medical emergencies.
In the same vein, the CEO of the Benin Medical Care, Dr. Gbenga Durojaye, considers the center a one-stop center, as it has such cutting-edge equipment that can render such services not yet seen in many parts of Nigeria.
Most of these equipments that we have, like the 1.5 Tesla MRI, are not available in some, permit me to use the word, big hospitals, even in Lagos or in Nigeria. So some of the services that we have, the facilities that we have, the equipment that we have are our strong points. The automated machines at the laboratory that gives you your result within 10 to 15, probably 30 minutes at the most. And then also the radiology, we have more than one ultrasound machines, we have CT scan machine, we have MRI. Another strong point is that all these services are in the same building, from consultation to diagnosis to treatment, which could require admission, and then to discharge. So we are more or less a one-stop center.
Healthcare is their concern. They are not resting on their oars. They are being proactive for the future.
We have a vision, not just for what we have provided at the moment, but even for the future. We are looking at minimal access surgeries. We are looking at bringing in more diagnostic equipment that can help Nigerians, make diagnosis of some of these conditions right early. And then we also have a community service responsibility mentality, in that we do outreaches from time to time into communities. So we are not just in quote for the rich or for the elite. We offer services to all.
It is for these quality healthcare reasons, in the last 2 years, the hospital has to its credit more than 30,000 consultations, about 1,400 admissions, more than 400 surgeries, and more than 270 deliveries, with a staff strength that started at 45, now stands at 125 full-time staff. Dr. Seyamo Okaiwile is a consultant obstetrician and gynecologist.
The obstetric and gynecology department in Benin Medical Care, we are here to offer obstetric and gynecology services. So this mainly involves women, pregnant women in the antenatal section for their deliveries, and then the gynecology services. Over the last 2 years or thereabouts, we have maintained regular antenatal clinics on Tuesdays and Thursdays, gynecology clinics as the need arises. We also offer round-the-clock obstetric services. So within this time, as a team, we have successfully had over 300 deliveries, starting from the first delivery, which was on the 30th of December 2019. And to the glory of God, we've not had any serious morbidity or mortality so far.
It is always good to have a good story to tell. Mrs. Lisa Osarieme Amienoho, who had her baby on June 4th, 2021, had a satisfying experience at Benin Medical Care and would be back again.
I actually heard about the hospital from a friend. It's really, really nice. It's amazing, compared to my former experience. I had my son somewhere else before here, before having my daughter here. So this experience is like 100%, the way they treat you when you come in and all that. The nurses and doctors, the way they even respond to you when you have ask questions, especially, they answer you immediately and tell you what you want to know. So I think this place is just perfect and really okay, and I would want to come back here again and again.
Righteous Philip Obo, the head nurse, takes us through a sweep of the labor wards, the equipment used to ensure measurement of the level of contraction, safe delivery, the monitoring of a fetal heart rate, the temperature and oxygen flow for a newborn baby.
This is the obstetric theater. In cases of emergency, maybe a woman has undergone prolonged labor or emergency CS, so this is where we take women, and it's so close to the delivery room, so you don't need to run a scatter or going from one floor to another. This is a suctioning machine. We have two to suction the blood. Those days you see blood spill all over the theater, but it's not like that again.
In terms of normal delivery, we have probably CS. This is the multi-parameter monitor that helps to check the pulse rate, the oxygen saturation, the blood pressure. It's all in one. We use it in terms of when we have difficult anesthesia, especially when we have to intubate the patient, as the case may be. That's when the machine comes in play, and we intubate the patient. This is a very good working anesthetic machine.
For preterm babies, extreme specialist care is offered in the Special Care Baby Unit, the SCBU. But a major pride of the Benin Medical Care is the radiology department, where Dr. Njoko Kalu reads out their range of services, plus their uniqueness within the South-South geographical region of Nigeria.
In this South-South geopolitical zone, I can confidently tell you that BMC is one of the few centers that have MRI. In addition to that, the MRI we have is a 1.5 Tesla GE Signal Explorer, which is one of the best currently in the world. I can also tell you that we do special MRI investigations apart from the regular MR investigations like brain MRI, spine MRI, abdominopelvic MRI, breast MRI. In addition to these, our equipment is capable of doing special studies like perfusion studies and then MR spectroscopy. These are studies that are not common.
Taye Oduma, the lead radiographer, takes us on a guided tour of their mammography, their digital X-ray sections, their MRI suite, the CT suite, and the ultrasound section. In all these, the radiology department's equipment stand out in the south of Nigeria, indeed in the country.
Digital X-ray is a very unique one. Is in the whole of South is the only machine that can do a whole spine pasting, a whole spine X-ray, which means we can acquire the whole spine all at once using that component. So this is what is used for acquiring that image. And here's a light beam. The patient stands here, position the patient, and then the X-ray tube goes from the top down to the bottom. So and when after acquiring the image, it pastes the image so you can view the whole spine of the patient. Also you can do a lower limb pasting, that you can do an X-ray from the pelvic down to the limb.
In its desire to be patient-centric and proactive, the BMC has a geriatric ward, a dialysis ward, as well as a recently launched VIP clinic.
So the VIP clinic is a brand new addition to all our services being rendered at Benin Medical Care. The concept is to offer premium and timely executive care to our premium guests and our premium clients. It's a one-stop center where you come in, you are checked in, you don't have to see them at the front desk, you are checked in here, and the vital signs are taken, and then you get to see the consultant, family physician, who is the doctor that will attend to you, listen to you, and any other specialist that you need to see will consult right here, and then diagnosis is made, investigations are requested for. At the same time, the phlebotomist will come up here to take the samples. The pharmacist will also come to deliver the medications. So it's a one-stop center, and the essence is to offer timely, premium executive care, in a cozy environment.
The EEG services in the BMC is a specialty. It is for unique diagnostic services, for the fact that it enables where MRI and CT scans may not be able to unravel.
This is the EEG room. EEG is electroencephalography, and it's an investigation we do to, in essence, capture brain waves and display them on the monitor. In situations where someone is suspected to be having seizures, convulsions, as some people refer to them, or even a suspected epileptic, in those situations, we want to see what the brain waves are and appropriately analyze them. Also, in situations where someone has lost consciousness, even if it's briefly, sometime in the past or recently, we also want to examine the brain waves and determine if there are any what we call pathologic or abnormal brain waves. So this is an EEG already done or captured of a client. So we have various ways that we analyze them. For a neurologist, this is handwriting, and we're able to analyze this and come to a diagnosis.
The physiotherapy department is now a very important one in the Benin medical care. Isaac Obasi, the physiotherapist, enables us to appreciate the expertise available and the quality care offered.
Physiotherapy as a medical specialty is mainly involved in helping individuals get back to normal, restoring function and independence, especially after going through a particular illness or condition. The services we provide here to outpatient vary. Because of the diversity in physiotherapy, the patients who present for treatment also fall under different categories. And that comes under the subspecialties of physiotherapy. It could be a neurological case, where we'll be talking about neurological physiotherapy. So in that case, we concentrate with a bias on neurological function of the body. It could be pediatrics, where we have to deal with children, infants. So that bias will be on pediatric physiotherapy. It could be with the elderly. When it comes to the elderly, our focus will be on geriatric physiotherapy. It could also be on integumentary. Sometimes we may have patients who have had fire incidents, having first, second degree burns, whereby we have to try to increase the level of motion or the range of motion to the affected limb or to release the skin that is not having contractions. We still have physiotherapy practice in women's health, that's in O&G, dealing with postpartum and prenatal exercises, especially pelvic floor exercises, in a situation where some women are going through stages of labor. Sometimes they come down with many pains, and even after delivery, there could be a condition called cystosis, which physiotherapy manages to. These are just other wide diversity in physiotherapy practice, which we render to patients. We have an area in physiotherapy, the orthopedic physiotherapy. There we deal with injuries, sports injuries, bone fractures, and trying to restore back to motion the affected limbs or hands.
Physiotherapist Isaac Obasi now shows us the varied sophisticated gadgets in use at the Benin Medical Care and their applications, like the dolphin massager, the electrical muscle stimulator, the transcutaneous electrical nerve stimulator, amongst many others.
This is actually a dolphin massager. This dolphin massager actually works in helping to loosen muscle tightness. It helps to relieve pain, because sometimes when there's poor circulation in muscles, there's bound to be a particular degree of pain. This now sends an intense vibration of that particular muscle to loosen it. This infrared has many functions. It helps to relieve pain. It helps to soothe muscle. It helps to soothe muscles to restore back to tone. It helps in circulation too. It has a sedative effect. Sedative being that over time, when you are attending to a patient who has been in so much pain, as you are working on the patient would feel so comfortable that he could even sleep off. This is an assistive therapy device. We call it the Zimmer frame. we actually use it in assisting mobilization, or should I say ambulation of patients who have lost normal functional use of their limbs due to being prolonged on bed rest. Especially in a situation where we have patients who are down with, like, let me say, a stroke, and over time the functional power of the lower limb muscles is being restored gradually of the affected area. We will now have to start what we call standing re-education, because from a condition like stroke, when the person is totally off functionally, we build the person back gradually, and that is by gradual ambulation to bring him back to a dependent or a near to dependent state again.
Another area of pride at the BMC are the laboratories. There are 2 laboratories, chemical and biological, which provide 24-hour services, and where, because of automated technologies, results come out from 1 minute to 15 minutes to 30 minutes to 1 hour, of course, depending on the study required. When studies are concluded, they can be sent online to the doctor. Mr. Osagi Igariwa is the head laboratory services.
This is a Human-Street 24 PT. It's an automated erythrocyte sedimentation rate analyzer, or an ESRO machine. Conventionally, results for ESRO takes about an hour, but with the help of this machine, you get your result in 15 minutes. And this can help guide the doctor in arriving at a quicker diagnosis and also reducing patient waiting time.
Now, with so much technology and sophistication at the Benin Medical Care, you may want to ask, can the services price be affordable? The CEO, Dr. Gwenga Durujaye, responds.
Our fees are actually very, very reasonable. In fact, for most of our services, we have the lowest fees in comparison with our competitors around. And so we've been, like I said, keeping in mind the founding vision, which is to lift people out of poverty. So the hospital is not set up primarily to make money, but at the same time to be able to offer quality services that people don't have to travel out of Nigeria to get, but at the same time at an affordable price, and then at a sustainable revenue for the hospital also.
In just these 2 years, the Benin Medical Care has 2 notable surgery successes that should make anyone know that home is always the best, and there will be no need for medical tourism. Again, Dr. Raphael Odia and the CEO.
We've done a knee replacement surgery here. We've done brain tumors. We are also thinking of venturing into assisted reproduction. Also, we'll venture into minimal access surgeries and even cardiac surgeries as the time will permit us.
Our focus is to offer preventive health care. And so even when people come in, even for consultation, we try to make it a point, an opportunity to offer health education, to our clients and guests that come in, even for just consultations. For example, somebody could be brought in by the children with diabetes or hypertension. And that is an opportunity to counsel those children too, because family history is a risk factor.
The Benin Medical Care can only look back with a lot of gratitude at this 2nd year milestone.
I want to use this opportunity to congratulate Benin Medical Care, especially our founder and CEO, for the vision of setting up an edifice like this to address the health needs of Nigerians. I want to appreciate our staff, those who are presently, our staff and those who have worked here before. Thank you for contributing your own portion in making BMC the great success that it is today. We also want to specially appreciate our guests and clients who have patronized us in the past 2 years. Thank you for believing in us. We hope we're able to meet your health needs, and we promise you that we are committed to our vision of offering excellent healthcare services to you and to everyone who seeks our care. And then to everyone out there, both in Nigeria and in diaspora, I want you to know that the future is bright as regards healthcare in Nigeria because of Benin Medical Care.
And as Benin Medical Care clocks a successful landmark of 2 years, the entire staff of Benin Medical Care make a shout out to their guests and the world that we care. we can, we shall.